Hello, welcome to our lecture on articulations, which is just a fancy word for joints. So in our title slide here, we have 6 types of synovial joints. These are the joints that we are most familiar with, things like our elbow or shoulder, hip, knee, stuff like that. These are all classified as synovial joints. We'll talk about that in more detail in a minute. So as I mentioned, an articulation is simply a joint where 2 bones meet. There you often will find cartilage, right? Technically, the sutures in your skull are articulations, where your teeth fit into your mandible or your maxilla are also articulations. So they are going to vary in how they move or how stable they are or how strong they are. And there are a couple of different ways to classify articulations. We can classify them based on their structure and based on their function. So what this figure really demonstrates is the inverse relationship between mobility and stability. Generally speaking, the more mobile an articulation is, the less stable it is, the easier it is to damage, the less robust it is. So the most mobile joint in the entire body is the glenohumeral joint, right? Your arms have a much wider range of motion than pretty much any other articulation in your body. It's also, right, the price you pay for that is you have some very delicate structures that are very easily damaged. So anyone who's had like rotator cuff injuries, any of that kind of stuff, you know, shoulders are easy to damage and they're hard to heal. On the other end of the spectrum, we have something that is profoundly unmobile, right? In this example is the coronal suture, right? This should not move in any way unless you're having a really, really bad day, right? Assuming you're an adult, right? When you're born, there's going to be some movement there, but by the time this actually turns into a suture, when it completely ossifies, hopefully at that point, this articulation will never move, right? The upside, that the fact that it's not mobile, means it is very strong and it is very sturdy. So just be aware we have the spectrum between mobility and stability. So I mentioned we have 2 different ways of classifying joints. We can classify them by their structure. Another way of describing this is what is their anatomic, what is their structural designation. So the 3 types of articulations based on their structure, they're classified by what is inside, what is between the 2 bones. You can have a fibrous articulation, which means the 2 bones are held together by fibers, you know, very often collagen fibers. They can be held together by cartilage. That would be a cartilaginous articulation. So you would find cartilage in between the 2 bones. Or a synovial articulation, which means you're going to have a fluid-filled joint cavity filled with synovial fluid. So you could say structural classification or anatomic classification of articulation, fibrous, cartilaginous, and synovial. However, we can also characterize articulations based on their function, or you could call it the physiological designation, because physiology means function. So here, the 3 categories are synarthrosis, amphiarthrosis, and diarthrosis. So in synarthrosis, right, arthrosis means having to do with bones, the angle between the bones does not move. Syn means same. So the angle between these bones always stays the same, which means the bones never move, which means it's an immovable joint, right? The bones aren't moving relative to each other. So a synarthrosis is telling you that that articulation does not move. Coronal suture, prime example. And amphiarthrosis means a little bit of movement, very, very minor. A good example of an amphiarthritic articulation would be the pubic symphysis, right? Very minor movement around this articulation. And the ones that we're most familiar with are diarthritic. Diarthrosis means it's a freely moving joint, like your elbow and glenohumeral articulation. So first, let's talk about the different types of fibrous articulations, type of fibrous joints. right? They're going to be held together by dense, regular connective tissue, held together by collagen fibers, all going in the same direction. That makes them very strong in that particular direction. So the three types we have are gomphoses. Gomphoses specifically refers to the fibrous articulation between a tooth and your jaw, your mandible, or your maxilla. So gomphoses is a fibrous articulation, so that's the anatomic designation. Gomphoses are also synarthritic, meaning they don't move, the physiological designation. Yes, I want you to know gomphoses is the anatomic designation, but gomphoses, their physiological designation is synarthritic, right? They don't move, right? Your teeth aren't moving around inside your jaw if you're having a good day. Next type of articulation, next type of fibrous articulation are sutures. These are specifically between the bones of the cranium. They are also synarthritic. Hopefully these things should not be moving relative to each other. Now the last one is a bit of a funny sounding name, and people can get a little bit confused with some of the names that will come later, is syndesmosis. Syndesmosis is the membrane, right, is the kind of articulation that you find between the radius and the ulna and the tibia and the fibula. If you remember, radius and ulna, you had those two interosseous borders that were connected by interosseous membrane, right? Well, that interosseous membrane is made of dense, regular connective tissue, and that is an articulation holding those two bones together. So it is a syndesmosis, right? When I do this, the radius and ulna, right? The reason why the radius is called the radius is because it rotates. When I do this, the radius is rotating on top of the ulna. So that's why it's called radius. So these two bones are moving relative to each other. That's the point I'm trying to make. So it is amphiarthritic, right? You don't have your ulna stay put and then your radius like move off to the side. That would be a bad day, right? They just move a little bit relative to each other. So they are amphiarthritic. So to review, gomphoses, we're talking about the fibrous connection between the teeth and the mandible, teeth and the maxilla. Suture is a fibrous connection between bones of your cranium. And the syndesmosis, this is the fibrous connection between bones like the radius and ulna and tibia and fibula. Gomphoses sutures are synarthritic. Syndesmosis is amphiarthritic. Small amount of movement allowed. This is just the example. So these periodontal ligaments, right, these are the collagen fibers that are going to connect the root of the tooth to your maxilla or mandible. Right? This whole articulation between these two structures, gomphoses. Right? The two bones of the cranium stitched together. In fact, that's the word where stitches, sutures comes from. Right, here we go. Fibers, collagen fibers holding these two bones together. And then finally, the example that I gave earlier, the syndesmosis. Right? Be clear, syndesmosis is a fibrous articulation. There's be some terms coming later on that are a little bit more confusing. Okay, let's talk about our second anatomic general classification, cartilaginous joints. So our first type is a synchondrosis. Synchondrosis and syndesmosis, that sounds kind of similar, right? So I said, don't get confused by that. Syndesmosis is a fibrous articulation. Synchondrosis, remember, when you see chondro, chondro means cartilage, and oftentimes it specifically means hyaline cartilage. So a synchondrosis are two bones that are going to be joined with hyaline cartilage. Right? Prime example that we've already talked about, the sternum and the various ribs. So you have that little piece of hyaline cartilage in between. So that is a synchondrosis. Right? Your ribs don't really move all that much in relation to your sternum. So it's classified as synarthritic or synarthrosis. Now the next type is called the symphysis. This may strike a bell. We talked about symphyses earlier, specifically the pubic symphysis, which is where the two pubic bones come together, right? Pubic symphysis is in fact a symphysis. Here, the cartilage is fibrocartilage. You will also find symphyses in between the vertebra of the vertebral column. Right? A symphysis is amphiarthritic. It is able to move a little bit. Now, you don't necessarily realize that so much thinking about your two os coxae that meet at the pubic bones of the pubic symphysis. We don't really think of our pelvis moving that much, but a good example of how a symphysis is mildly flexible if I do this, right? What am I doing? I'm just bending my vertebral column. Each symphysis between each vertebra can only move a tiny bit, but because I have so many vertebrae, each of those articulations allows for a small amount of movement. Lots of small movement will actually allow for a large amount of movement. So when I lean to one side, when I bend my spine, right, that's an example of all those little tiny amphiarthroses adding together. So synchondrosis, we're talking hyaline cartilage between the bones. Symphysis, we're talking fibrocartilage between the bones. Synchondrosis is synarthritic. Symphysis is amphiarthritic. Right, here is our example. Sternum, we have ribs, we have that piece of hyaline cartilage in between the two, synchondrosis. Technically, the epiphyseal plate and the epiphysis and the diaphysis, this is a synchondrosis because we have bone, cartilage, bone again. Symphysis, as I mentioned, the pubic symphysis, and we have the intervertebral discs. Okay. Now let's talk about our third anatomic designation, synovial joints. Synovial joints are all classified as diarthritic, so they're free moving. So we're going to have a number of structures inside a synovial joint. They will have an articular capsule, right? So they're going to have this outer case of dense regular fibrous connective tissue. Inside of that capsule, there will be a cavity. That cavity will be filled with synovial fluid, right? We will have articular cartilage. We talked about this before in our introductory chapter to bone. Articular cartilage is a layer of hyaline cartilage at the epiphyses of the articulating bones. Two bones come together, where they touch, they will be covered with articular cartilage, which happens to be hyaline cartilage. Synovial joints will also have ligaments attaching the two bones together, right? Dense, regular connective tissue connecting bone to bone. And of course, you're going to have nerves and blood vessels innervating these joints. So let's talk about the articular capsule. It has two layers. It has an outer fibrous layer made of dense, regular connective tissue, right? This will provide some structural support, some structural strength to the articulation. And inside of that, we're going to have a synovial membrane. And the synovial membrane is responsible for producing the synovial fluid. So here is our basic picture. We have here, looks like probably a phalange. We have, right, the periosteum. Outside the periosteum, we have the articular cartilage of one bone, periosteum of another bone, articular cartilage of the second bone. On the outside, we have dense, regular connective tissue making up the fibrous layer of the articular capsule. Deep to the fibrous layer of the articular capsule, we have the synovial membrane. Right? The synovial membrane is going to be producing the synovial fluid that fills the joint cavity. So what is in between these two bones? Synovial fluid, produced by the synovial membrane, which is just deep to the fibrous layer of the articular capsule. Remember that the articular cartilage also serves as a bit of a cushioning and a nice smooth surface. So when these bones touch each other and rub each other, there's very low friction, both because of the synovial fluid and because of the articular cartilage. See here, as I mentioned, articular cartilage covered with, articular cartilage is hyaline cartilage covering the epiphyses of the articulating bones, reduces friction, acts as shock absorber. The joint cavity is created by that articular capsule, right, and is filled with synovial fluid. Now, synovial fluid plays more roles than simply lubrication, but will actually nourish chondrocytes in the articular cartilage, right? And will actually act as a shock absorber itself. So the cells out here in the articular cartilage, particularly the ones that are at the sort of the superficial layer, right? You can't get blood vessels in here. So they're going to have to get their nutrients and oxygen from another source, and they will actually get it from the synovial fluid. Ligaments, as I mentioned before, dense regular connective tissue connecting bone to bone, help strengthen and reinforce the joint. Nerves in these areas are going to help us detect pain, stretch, and position. So you have a number of sensory receptors that we'll talk about in the special senses section. They give us what's called our proprioceptive sense. The proprioceptive sense lets us know where our various body parts are without actually having to look at them. So if you ever get pulled over for, a DUI, right, and the cops are going to tell you to touch your nose, they're testing your proprioceptive sense. With your eyes closed, right, can you find your nose with your fingertip? And of course, blood vessels. Okay. This is just another figure I took from another book, which made things, I think, a little bit more clear, so I included it. Right. Here we have synovial joint of the elbow. If you look carefully, you should be able to see that this is a gross mid-sagittal cut, right through the elbow, and this is a lateral view. So what we see here is part of the trochlea of the humerus. We have the trochlear notch of the ulna. We have the head of the radius articulating with a capitulum over there. So you can see here is our articular capsule. This here is the capsular space. Inside the capsular space, we're going to be filled with synovial fluid. Okay, let's talk about some accessory structures that we find with synovial joints. The first up is a bursa. So a bursa is a sac usually located just outside of a synovial joint. Areas where you tend to have a lot of compression or a lot of rubbing, and you need extra padding to prevent damage. So this is where it says where you see ligaments, muscles, tendons, or bones tend to rub up against each other or against bone. There you will have bursa to act as padding. Also, you'll have a fair amount of adipose tissue or fat in this area, which also acts as padding. But sometimes the fat is not enough, so you need the bursa to protect these tissues. Now, in certain areas, you have lots of tendons all in a very small, compact area that are all running parallel to each other. And then you're going to get elongated bursa, which are called tendon sheaths. So tendon sheath is a bursa, it just has a slightly different shape. And you tend to get tendon sheaths in places like your arms. So carpal tunnel syndrome is inflammation in the tendon sheath in your forearm. So an example, right, this is the knee joint. We can see the articular capsule in here. We have a suprapatellar bursa, just a bursa above the patella. Right. We have the patellar bursa, and we have infrapatellar bursa just below the patella, which is your kneecap right there. Right. We also have two meniscus. So the meniscus are actually made of fibrocartilage. But we have synovial fluid in this joint. This brings me to an important point. Some students will look at the knee and go, that is fibrocartilage. Therefore, this is a cartilaginous joint. Some synovial joints have pieces of cartilage inside of them. If there is synovial fluid, it is a synovial joint. End of story. It may have cartilage, it may not have cartilage. If you see an articulation, if you see a joint that has cartilage, hyaline cartilage or fibrocartilage, and does not have synovial fluid, then you can call it a cartilaginous joint. But a lot of synovial joints have pieces of cartilage inside of them. That does not make it a cartilaginous joint. any joint that has synovial fluid in it. Doesn't matter if it has anything else. If it's got synovial fluid in it, it's a synovial joint, end of story. So don't get tripped up or confused by that. Okay. Here, I don't want you to know the particulars of the tendon of the flexor digitorum profundus, right? This is stuff we'll cover in muscles. What I do want you to realize is this is a tendon sheath, just an elongated bursa to prevent damage, friction, and rubbing for the various tendons that will control the fingers. Right. The muscles that power the hand are not inside the hand. The hand would get too big to be of any real use. The muscles that power our fingers are here in our forearm, right? Don't believe me, grab your forearm, right, and then make a fist. You can feel that these muscles are what's flexing and acting. However, you have to find a way to transmit the force being generated here, way out here. What's going to do that? Long tendons. And there's lots of different little muscles in here controlling all the various detailed movements of the hands. So we're going to have a lot of tendons running through this area. They need to be protected, and they're going to be protected by a tendon sheath. So don't sort of freak out at the details of this particular slide. I'm not going to go into super crazy detail on the anatomy of the knee. I will point out what we need to know for the knee in the second part of this lecture. And also the details of the tendons here, you don't need to worry about. We'll learn those when we learn the muscles of the forearm for the next section of this class. Okay. We have another way of classifying synovial joints by how they move. So a uniaxial synovial joint will simply move in one plane or axis. Biaxial moves in two. Multiaxial moves in any. I will probably not ask you to classify synovial joints based on if they're uniaxial, biaxial, or multiaxial. Just realize that some joints have greater degrees of freedom than others. Like, for example, my thumb can go, this articulation right here can go this way or it can go that way, right? This way or that way. It can't go to the side. Right? It would be nice maybe if it could bend that way, great, but it doesn't. It only bends this way or it bends the other way. Right? An example of a multi-axial synovial joint, your shoulder, right, can move in a big old circle. It can move forward, back, up, down, right, left. It can do many different things. Multi-axial synovial articulation or uniaxial. Okay. Now, one thing I do want you to be aware of are the 6 types of synovial joints, the 6 types of synovial articulations. We have plane joints because they are just flat planes butted up against each other. You find these quite commonly in, say, your carpals or your tarsals. You have a hinge joint, right? Your elbow is a great example of a hinge joint. Pivot joint, condylar joint, saddle joint, ball and socket joint. Those should be familiar. Think of the humerus and the femur. So what I would do is memorize at least one example of each, because that would at least allow you or help you to identify them if I asked you to classify synovial joints based on, right, which of the 6 types is it. So here, this figure has lots of good information. Right? Look at the elbow. Here we have a hinge joint. You can see how it's set up. Ball and socket joint would be the femur sitting in the acetabulum. A pivot joint, right? Good example of the atlas and axis working together. Condylar joint, these would be, say, the main knuckles of your fist, right? These are condylar joints, right? They can move forward and backward, I should say anterior and posterior. They can also move medial and lateral, a little bit, not a lot, right? They can move a little bit medial and lateral. Okay. However, see that trapezium that I told you, right? Your thumbs are highly acrobatic. It has lots of movement. The articulation between your trapezium and your first metacarpal, this is a saddle joint, right? Which is how it is able to be much more flexible, have a much wider range of motion than those condylar joints. So I believe that is all 6 various types. Oh, right, and the plane joints that I mentioned are in the carpals. So be familiar with these, know an example of each one of them. This figure sums up the entire lecture thus far, right? You have anatomic designations of articulations, fibrous, cartilaginous, synovial. We're just describing what is in between the 2 bones. Right? We have subtypes, gomphoses, sutures, and syndesmoses for fibrous, cartilaginous, synchondroses, and symphysis. Right? Do not confuse synchondroses with syndesmoses. Synovial fluid, right? Plane, hinge, pivot, condylar, saddle, and ball and socket. They give you a nice example of each. And yes, you do need to know the functional classification for each of these. Gomphoses, synarthritic, suture, synarthritic, syndesmoses, amphiarthritic, synchondroses, synarthritic, symphysis, amphiarthritic, and synovial is all diarthritic. So pretty much almost everything that I've gone over so far is summarized in this table here. So definitely put some stars across the top, spend some time with this table. That brings us to the end of part 1. In part 2, we'll talk a little bit about the motions that articulations can make, the motions that bones can do. But we'll cover that next time.